With its inception in 1981 under Salem Brotherhood, Uganda, by Salem International as an aid post and grown into a small health center to initially manage the children and elderly, Kolonyi Health Center 4 has made gigantic steps to reach the level of a fully fledged health center 4, with currently plans to be elevated to a general teaching hospital, since the organization also operates a training school for student nurses and midwives at both certificate and diploma levels. Ironically, the facility is only recognized by local government as a health center 4, much as the Medical Council recognizes and licensed it as a hospital, and it is private and not a profit facility. The center is multidisciplinary with curative, preventive and rehabilitative services. It has a hospital that operates 4 wards: the maternity ward, general ward for both male and female patients with medical and surgical illnesses, private ward, pediatrics, and nutritional wards. The hospital too has a laboratory that has the capacity to conduct tests including biochemistry, hematology samples, stool analysis, over and above the conventional MRDT and BS. The facility provides ultrasound services with a Doppler function, which are very important for the detection of early pregnancy complications, for example, ectopic pregnancies, blighted ovum, incomplete abortions, among others. According to Dr. Chimbugwe Charles Wanzige, a medical superintendent at Salem Hospital Kolonyi, their activities are supervised by the Ministry of Health through local leadership of MBALE City Health Office, and the facility has different services at subsidized costs because of cost sharing.
It is a private, not-for-profit, meaning we do cost sharing with the patients, some services which are completely free, and then some services which we do cost sharing. And we are affiliated to Uganda Protestant Medical Bureau, and our activities as a hospital are supervised directly by Minister of Health through the local leadership of the City Health Office in MBALE City, where we are located. And now, as a facility, we have different services, and we have a strong community-based services, which involves involving the community health teams, the VHTs, sensitization meetings, and we also do some community-based projects. And currently we are implementing a malnutrition project, which is community-based. We also have services which are static, and that's the outpatient services. We have the lab, which has a very pretty good lab. We do the best tests, and we are able to do the chemistry, meaning we are able to really detect complications early and manage them early. We also have an imaging department. We have a very good ultrasound scan and an X-ray, digital X-ray machine. And therefore, this also helps us in our diagnostics, pregnancy-related complications, which is very key in improving maternal and child health outcomes. We have the inpatient department, we have the pediatric department, that is the child health, which is also divided into two. We have the general pediatric and the malnutrition wards. So we manage the patients inpatient, The nutritional cases also, we manage the inpatient and the outpatient. We have the inpatient maternity wards and the gyn wards, and we have the general surgical and the medical wards. We also have a private ward. Among other services, we do have the mortuary, which is also part of the facility, which is a new, and all these services, like I've said before, they are very subsidized.
However, he says, based on the kind of services and population they serve, the facility should be elevated to a general hospital.
At this level, we are actually a well organized, we're actually supposed to be at a general hospital based on the kind of services we have, based on the population we serve, and many other reasons. And the big challenges in providing services, because our community being in a rural urban setting, our community largely, most 65%, even when you told them, for example, the delivery is, if you have attendant into here, is 15,000 shillings. But you find that there are people who cannot afford that 15,000. So we are looking at how can we sustain these services, and we've seen that we can only sustain the services through partnerships, and the most important one is if the Ministry of Health, the government of Uganda, can have more support. One, how can the government support? With the general hospital means more government involvement and more government support in terms of the seconded staffs, for example, like staffs who are employed by government but seconded to work here.
Dr. Chimbugwe also says that the relationship the hospital has with different partners is immense and helps the institution so much.
We have had a very good local partnership with the Ministry of Health, because they do support supervision with us. They support us with the PHC fund, which is much, it is 4 million quarterly. Of course, much as we think that is like something, a dot in an ocean, but we are very appreciative. The other thing is that the government also used to support the facility with about 3 secondary staffs, which were withdrawn. And then, of course, we have support from government through supervision, direct from Ministry of Health, but also from the local CHO office. Now, the other partners, we have the UPMB. UPMB has supported us in areas of TB and HIV, and also supporting directly some supports to have services here. And they have also initiated some projects. For example, the streamline system came through the UPMB and is trying to promote the community financing, which I will talk about. Now, the other partners, the local partners, like GMS is Joint Medical Stores. We work with in terms of maintaining the quality supplies. And because we are very particular on the quality of healthcare in this facility, and we partner with people with the same ambitions, with the same vision. And then we have also had an opportunity to have partnership with Tukolera Wamo, which is It has a branch here in Uganda, but also a branch in Germany. And they have supported us in different ways. One, they have helped us in capacity building, human resource. They have supported our staffs here. Particularly, we have had one staff who trained an anesthesia, and then he did a postgraduate, did a diploma. After another diploma in nursing, then he did a diploma in anesthesia, to try to support and have improved the emergency response.
Wilson Mukisa, a senior clinical officer at Salem Hospital, says they started with a low turn of 10 patients a month, but now they receive over 200 for scanning using the skills he got from the German doctors.
We have ultrasound machine and we have X-ray machine. We are offering these services here. I joined Salem as a clinician, and through Salem organization with their good partners, that is Professor Miapo and Hula, they really work tirelessly to look for money to take me back at school and to do ultrasound, which really I did with one heart. And after school, I came back to start ultrasound services in Salem. And as I started, we started with a low turn-up of around 10 patients per month, but right now we are seeing over 250 patients per month. And the skills I've gotten, they have really helped so many patients. Nevertheless, through Salem organization and with partnership, clinical partnership with German doctors, I was really granted the chance to undergo numerous trainings, both here and outside Uganda, that is in Germany, in Trier, Bamdiza. I really thank Dr. Luz and the entire German doctors because of what they did. The trainings, they didn't leave me the same.
He also says that the radiology department does a lot of services ranging from abdominal, breast and other ultrasound scans.
We really offer ultrasound services, which starts with obstetric ultrasound, which includes first trimester scans, second trimester scans, and so many concerning obstetric scans. Then we do abdominal ultrasound scans, whereby people are coming in with pain, abdominal masses, which they don't know. We really do these scans. We don't end only there. Through the numerous training I got, I'm able to do thyroid ultrasound scan. I'm able to do scrotal ultrasound scan. I'm able to do breast ultrasound scan. And some, although with limited knowledge, but I try to help people, especially people who are over coughing. I really am doing screening of the chest ultrasound scan in case we are suspecting diseases like a TB.
Mukisa says over the time, Salem continues to grow based on the service, number of patients and the modern equipment they have.
Turn up when I joined here in 2007, the turn up was not really good, but I like that over the years, as I'm growing, Salem is also growing. And this is because of, one, German doctor gave us a new machine. They have imparted new skills in me. And I'm seeing a potential of me seeing 50 patients a day. That is my dream, that I'm able to help as many as I can.
Inyangat, the in-charge MCH, says mothers who have joined Salem Hospital Community Insurance and have attended antenatal for at least 3 times, it's very cheap to deliver from the facility because the charges are so small. She also says that one of the challenges that face the department is the increasing number of mothers who come as emergencies from different health units, and by the time they reach the hospital, the situation is worse.
We take care of these mothers who come in antenatal when they are pregnant. They come this side, and also we examine them. Those who prefer to be done the scan, we do the scanning. The scanning is something very cheap, unlike other areas. For us here, scanning is only 15,000 if a mother comes when she's pregnant. So we only charge her 15. Meanwhile, antenatal itself is a free service because we are NGOs, not for profit. So we are here to labor the work, to do the work, to help those people who are in need. And also, for sure, not to say everything is free. There's a small percentage of money that we charge them. Because of delivery, for example, now when you come to the deliveries, if they have attended here antenatal at least 4 times, we charge only 15,000. But also, we have also a scheme, which is community health insurance. So we are dealing with the communities, and we are trying to encourage them to join this insurance, whereby, like if a mother came here to deliver, she now delivers freely. Yeah, this department really is a department that has quite many challenges, and mainly we receive mothers from other health units as emergencies. They have delayed from wherever they may be, then they reach to you. You have always, the good part of it, we are 24 hours alert. So we are working 24 hours, and we make sure that all these mothers, as they come as emergencies, we take the history very fast, we examine. If we find there's a complication, we inform our theater team, and the patient is rushed very fast to theater. For example, those with obstructed labor, you find our doctors are always on time. Just you give a call, and immediately they come, because they stay within here. So it's not a big challenge now, that one. Though really sometimes we are forced to use so many supplies. You pick this, pick the other, and do this, hand up. Sometimes even some are referred without even inserting a cannula, because that would be the best thing if somebody is already on a cannula. Even if she collapses, you find that it's easy for you to run the fluids before the doctor arrives. But now here you have to make sure you are rushing, putting the cannulas, you are doing everything, taking the history, but we have teamwork. That's what I like in Salem. But there's this delaying at home. Somebody comes even to the other health center when she has already delayed from home. Then by the time they come to this hospital, to the health center, you find even that one now says in her notes that she had just arrived. So we are trying to say, we are talking to the community, that when labor starts, it is good for you to reach to any health center you prefer. You have a right to go wherever you want. But we're also here saying, we are existing. Kolonyi is existing, and we are trying our best to rescue lives. God has helped us, really, and we have always rescued very many lives in these matters. So we are telling them, in case it is in the health unit and the patient has delayed, it's better for you to send immediately. Or when she has just arrived to you from the community and you see that this condition you may not be able to manage, it's better for you to refer. You feel free to refer wherever the patient or the attendants wish.
Grace Akol, the in-charge of the theatre, who was in the consultation room, explained to us the process one goes through to the theatre.
So basically this is the theatre, and the activities we carry out. One, this is a consultation room for the doctor, where a doctor checks all the files of the patients who are supposed to go for operation. So when they are here, they interact and he gets more of the details from this room. So he examines and confirms what is going on with the patients. So after that one, then we move out to the rest after he has cleared everything. When it is an emergency, we don't come to the consultation room. Like if the mother has come, Caesar, maybe other cases, from maternity directors we receive, we have the other inlet where we shall show you. So emergency, we don't really wait. We take her, take brief, and then rush her to theater. And then after that one, we talk to the relatives and they give us the data and everything. But still they have to examine to know actually what is the problem. So when it is emergency, it is rushed. We don't wait with emergency people.
Okay. Here is the consultation room. You come here first, then you go for theater. As the nurse has explained, or as the in-charge theater has explained. So after here, we are also going to the theater to see what exactly happens there. We are still at Salem Hospital, and now after here we are going to the operation room to see exactly what happens there as these people try to make us go through the entire process.
We are getting ready for the surgical operation. My name is Rone Edith. I'm a theater assistant here. I assist the doctor meanwhile operating. Before we go to the surgical operating room, I always make myself protective. I protect myself by putting on the apron, which I'm already on, and the gumboots, plus the mask itself. And also another thing, we have to wash hands surgically.
As you leave the scrubbing area, you enter the operating room, and the other trolley, which is behind you, will be there with sterile equipments. So you dress up with the gown, which is sterile. Put on gloves. Now after that, you're ready to do the surgery. So this is the trolley we use for setting those instruments for surgery. You may call them metals, but for us we call them instruments, which we are going to use. This is the trolley we put those instruments.
What I was trying to explain is the trolley is not set for now because we know that anytime a patient is arriving. So that's why we have not set anything. So this is our operating table. This is the operating table, and the anesthetist, the machine is the other side, and then all the equipment is covered because we have to keep the sterility. So we are just showing you the overview of the place. Otherwise, we are here, the people doing work, can talk to the anesthetist, assistant surgeon, she's here.
We are having a patient now, take for example, on our operation table, and the doctor is ready from the scrub room and all sorts of being sterile. Is now ready to come for operation with his surgical assistant. So the doctor stands this side and the assistant stands the other side, whereby they are all sterile to perform the procedure. So here, and also this is where the anesthesia is administered before starting any surgical procedure. The anesthetist is here. He performs this procedure of anesthesia before starting the operation. This is all to remove the pain from the patient while carrying out the operation. And these are the lights we have. These lights help us to focus. They help us to focus on the site of the operation while the doctor is working and the surgical assistant just show where the doctor is supposed to operate the specific part.
My name is Silas Kotong, an anesthetist in Salem Hospital. And basically what I do here is give anesthesia or make patients free from pain when they are operating on them. We have two routes of giving anesthesia, depending on what the patient prefers, and also how I've assessed the patient, and I choose which one is fit for the patient. We have the regional, which we mostly use on obstetric mothers and gyne cases. This is where a mother is given an injection at the back, and a drug is introduced into the spinal space, and that drug paralyzes the mother halfway, so that when the doctor is operating, the patient is just relaxed and even smiling. It takes 4 to 5 hours, but you realize that most cases we take like maximum of an hour, and we are done with the operation. So that drug gives an extra pain relief. Even when the patient is taken to the ward, the patient will not be having that pain. It's after that the hours that now you can add another painkiller to the patient.
So your work is generally to reduce pain?
Take away that pain.
Take away pain?
No pain.
Okay.
Yeah. This goes to the patient. Now, depending on what, if you are just administering oxygen only, you don't need to turn this on, depending on what you're doing. If I want to only give oxygen to the patient, I don't need to turn this on. What I will just do is put oxygen on from there, turn on my machine, then I just adjust the oxygen flow according to the liters I want to give to the patient. Now, once I'm through with that, now the oxygen from the other side to the machine, delivered from here to the patient. So the oxygen is now here. So to the patient, this mask is now put on the patient. Now, if I'm doing a general surgery where I need the patient to sleep, this is where now I will use this. This one makes the patient sleep during the entire process of the surgery, and when the surgery is done, that's when now I can reduce this so that the patient wakes up. Yes, please. Now, there are signs that a patient can show. As a trained anesthetist, I will detect those signs that, with these signs, this patient may be having pain. Like they start, you see this? When they start having wrinkles here, it means somehow the pain is somewhere. Or they start tearing. That will indicate you that somehow this patient is feeling pain. Then you act appropriately. Then that is for someone who has been made to sleep. But if someone has been given anesthesia which is halfway, of course that person is able to talk. So you ask, how are you feeling? The patient will be able to tell you, so I have pain in this side. So you will act accordingly. That one, the patient talks. But the other one, where the patient is asleep, you will just, you see those signs of pain the patient is showing you, like what I've said, tearing, wrinkling on the forehead.
You think he's asleep and he's dead?
No, there is no way a patient can be asleep. You see, now that's where it comes to this monitor. You see, all this work in hand, okay? This one makes the patient sleep as well as giving oxygen to the patient, right? Now, this machine monitors your heart, how your heart is beating, how your lungs are breathing, yeah? Then your blood pressure and so forth, okay?
We encounter challenges due to late referrals. So us as final consumers, when we receive them, we get so many challenges. One, like the mothers being referred. The mother has been told, for example, the mother has been told to push maybe from 7 to maybe to 2. Then in the midnight, I mean at around 3 or 4, they had to bring her here. So one of the challenges we have really faced, this mother comes with obstructed labor, and after that one, there is always a PPH. So with the PPH, it takes a lot of supplies, that is equipment, there's gloves, gauze, like that. So you must make sure that you really have to save life. So the team has to work a double hard. Many of the supplies are being used. And also we have to make sure blood is on standby. You know that process at that time when you receive that patient. So you have to really have a very strong team which runs up and down. Addressing the challenges, these challenges of late referrals, we have always appealed to our colleagues, the neighboring, the referral units, that they should help refer the mothers early so that we save, at least we are also able to save them very fast.
Salem, Uganda supports all health workers, and you just need to pick interest in whichever discipline you would like to do. Like for me, I showed interest in anesthesia, and they supported me, and now I'm here offering the services of Salem, reducing the delayed time of the patients, because you realize that previously someone has to be called from out there to come and give the services of anesthesia. But right now, since I finished, that time is cut off. There is no delay. Once an emergency comes, I'm always around. The patient is worked on immediately, and the baby and the mother are saved. So to my colleagues, please, Salem Uganda is there to support us, and we should also support them by really embracing on these scholarships. Let's do them and come back and offer these services to our communities.
Thank you, our cameraman. We as Bukedi Times, we are still touring the place, and I just want to appeal to the public, because many people out there don't know what is exactly here, and whoever has some complications, you should always come and visit this place. We are still touring the departments across the entire facility, and just keep watching Bukedi Times. Stay tuned.